Now, as everybody knows, Swachh Bharat seems to have become a bit of a catchphrase for the last 3 or 4 months, ever since the Prime Minister of India, Narendra Modi, launched his Swachh Bharat campaign. We've seen lots of public initiatives, lots of corporate initiatives that have also sort of jumped on this bandwagon, and I think it is an extremely important objective, not just for a government, but for all of us as citizens as well, to ensure that we have clean living, healthy living, sanitation, water, hygiene, education, all these things having to work in tandem for a country as large as ours. And I'm being joined by a very esteemed panel to talk about how we can all work towards implementing and measuring and creating outcomes for some of the initiatives that have been talked about both yesterday and today. I'm going to ask Jack Sim of the World Toilet Organization to open with your experience and also how you see outcomes that can be measured.
Thank you very much. So I will be very blasphemous to say the problem. Basically, NGOs started off wanting to do good, and they end up trying to survive. And this is the fundamental problem of the development sector. Donors funding NGOs in silos, and in a way they become dividing the NGOs. So the NGOs think, oh, this is my donor, I don't want to share my donor with you so that I can pay my salary, and then they forgot about the mission. So what happened is that as the donor funds start to shrink, they got into another type of trick, which is to count all together. So let's say 10 people or 10 organizations put money into a center pool and help to build 100 toilets. So then how will this be counted? It will be counted as 1,100 toilets instead of 100 toilets. Why? Because each of the member who put in a little bit of money will count as one time. And then they will count the group as one time. So instead of one time, it becomes 11 times. And if you have a global audit, then this is actually illegal, right? But this is actually what's happening. So the way to go forward is not to work in silo, but to unlock the synergy of people coming together and to have a holistic, integrated approach, so that if you are driving demand, I am driving supply, you are driving logistics, you are making public policy, you are making more efficient bureaucracy and invention and all that. If everybody is being met and matched and motivated, then we can measure. So I would suggest this 4M approach: map, match, motivate, and measure. Thank you.
Well, I think that's very important. Map, match, motivate, and measure. The 4 M's, as we're going to call it from this moment on. I'd like to ask my other panelists as well to sort of come in with their views on this. Patty, why don't you tell us about some of your ideas when it comes to integration, working in a country like India?
I think certainly we need to focus. There's been a lot of talk over the past couple of days about metrics around how many toilets we're going to be building. And I think we need to put equal emphasis behind how much demand creation are we going to generate. Because demand creation has to come before infrastructure if we're going to actually be able to have a sustainable approach going forward. So how do we go from metrics today that look at infrastructure to metrics that look at behavior change, and then eventually motivate ourselves to get to metrics that look at outcomes? And we're looking at health outcomes in order to have a healthier Indian population.
Right, and I think those health outcomes are something that we're all sort of striving towards. And you did talk about how this is a global perspective you're bringing to it, but also for the sake of understanding, when you're looking at measures like this that you want to scale up and bring to the largest number of people possible, you're looking at a cultural diversity, a cultural milieu that can often be challenging in this kind of sector. Payton, from the perspective of the World Health Organization that's spearheaded so many health-related campaigns, how do you see these challenges being impediments really in the way of creating awareness for sanitation, hygiene, health?
Thank you. Instead of impediments, I can share some success stories from India, and that is mainly from the polio eradication program in India. WHO, together with UNICEF, had been very successful in mobilizing partners, not only in India, but also at the global level, at the national level, and also in the district, state level, to mobilize people, funds and people to eradicate polio. So that is a huge success story for India as well as the region. And I think we can tap into the resources that WHO and UNICEF have been able to mobilize, mainly in terms of people, volunteers, surveillance workers, polio and immunization surveillance workers at the grassroots level. These people can be tapped into for reporting and monitoring of sanitation activities, mainly in terms of use of toilets. Now, number of toilets, it's very easy to monitor, but changes in the use of toilets, hygiene promotion, hygiene practices at the household level, these are quite difficult to measure, but WHO has been able to use this grassroots worker to influence the community. So I think this is a very good area where we can tap into. We are ready to help come to assist the government into integrating such sanitation reporting monitoring systems with the existing workforce which is there in the country. And in terms of cultural changes and attitudinal changes, it will take time, but I think again in the polio eradication program, several religious leaders and other leaders in the villages have been used. So we can look at using such, again, village champions to motivate and also to change the behavior at the grassroots level. Thank you.
Right. I think it's a very interesting thing that you gave the polio campaign as an example, because pulse polio in the country has become such a catchphrase across the health sector. In fact, I think it was on Sunday in my email box, I got a message from Rashtrapati Bhavan, the President's Palace, with 2 images of President Pranab Mukherjee administering the polio drops to 2 infants, families, I guess, of people who work there. So I think, in fact, that brings us to one of the key things that I think has even brought all of you together here today, which is the fact that Clean India is something that we've all been talking about, you all have been talking about for years and years and years, but it's kind of got this fresh surge of interest because there is a top-down, government-led, prime ministerial-led involvement and approach. Hari Menon, I want to ask you, how do you think all of you in the NGO sector can try and maybe push your proposals and ride piggyback, in a sense, on the back of this government impetus?
Thanks, Maya. I think the fact that we're even having these kinds of panels is an indication of the changing times. I mean, sanitation until last year was neglected, and now it's not anymore. And I think a lot of it has to do with the fact that the Prime Minister has chosen to give a lot of prominence to this issue. And agree with you. I mean, I think this does create a unique kind of political momentum that we really need to leverage over the next 5 years. That this Prime Minister's leading is great, but I think this also has to now translate down to the state and sub-state levels, particularly at the rural levels where the bulk of the problem in India is. I think for organizations such as ours, the Gates Foundation, WHO, WTO, several others who are here, and even others who are not here, like the World Bank, ADB, who are part of this mission, I think the critical part is to come up with a unified results framework for what we need to measure. And I think Swachh Bharat mission in the rural areas is going to look very different from Swachh Bharat in the urban areas. So we need to be measuring different types of results. In the rural areas, there is still a very large burden of open defecation. And so ending that is the outcome that we really need to be able to push for, obviously then resulting in the health-related outcomes that Patty referred to. But ending open defecation remains the biggest challenge in rural area. And so the behavioral interventions, the supply-side interventions to enable that, and then tracking whether the behaviors actually have resulted in increased and sustained toilet usage.